If Local 3's health and welfare plan is part of your collective bargaining agreement, then you have been gifted with a great benefit. This means that when you or your family members, dependents, go to the doctor, part or sometimes all of the bill is paid by the benefits your union has negotiated on your behalf. As with most of Local 3's benefits, think pension, wages, annuity, training, dispatch hall, the health and welfare plan for active participants was just another well-thought-out decision made by those who came before us. Local 3's Health and Welfare Fund was established in the mid-1950s and is considered a Taft-Hartley plan, meaning it is managed by a board of trustees made up of both labor and employer representatives. In this way, the interests of both parties, union and employer, are negotiated since both parties participate in the plan. In a way, it's like a shared investment between two spouses. They may not always agree, but they have the same goal in mind. When the plan began, it covered a daily allowance for hospital stays and a percentage of doctor bills. Prescription drug coverage began soon after, with participants paying only $1.50 copay per prescription. Today, the plan covers so much more, including hospital stays, prescriptions, dental costs, vision and mental health benefits, just to name a few. Local 3 has health and welfare funds for members in all of our 4 states, California, Nevada, Utah, and Hawaii, with funds for retirees, as well as a public and miscellaneous trust fund for many of our public employees. So how does a fund that paid out about $240 million last year in medical benefits work? Much like the Local 3 pension, health and welfare fund is made up of money invested through your agreement, plus the interest earned on this money. Contributions are made each month based on hours worked under the collective bargaining agreement and interest earned. A member and his or her spouse and children under 26 are covered under the comprehensive plan when the member meets the eligibility requirements based on a certain number of hours worked per month for most. Some have a flat rate contribution per month instead of hourly. If the member continues to work that certain number of minimum hours, eligibility continues. All hours go into an hour bank, and the number of hours needed for a month's eligibility is subtracted from the bank to give a month's coverage. Please look at this chart, which is an hour bank example for California after initial eligibility is established. For the regular Local 3 health and welfare plan, the following is covered in some part: hospital, emergency room, doctor visits, surgery, outpatient lab and x-ray, routine physical exams, hearing aids, and much, much more. It's a comprehensive list indeed, and if you would like to see what else is covered, check your summary plan description booklet, which is mailed to active members and regularly updated. What if you did not have good coverage like this, and you ended up in the hospital for a few days? Would you be able to pay the costs? We've seen bills that amount to $60,000 and more in cases like this, and you'd be stuck with the whole bill. We're so fortunate to have our good coverage to take care of a large portion of these bills for ourselves and our families. The majority of members have medical benefits through our regular plans, but check provisions of your own state's plan. We advise members to check their preferred provider list and see if their doctor is on it, as doctors and clinics within this network usually cost less. Check with Anthem before visiting a doctor and undergoing any medical procedure. Visit the Trust Fund's website at oe3trustfunds.org for providers in your area, as well as plan rules and regulations. Again, you can also find this information in the giant booklet mailed to participating members. Not only is staying healthy important for us in terms of overall joy, but it is also prudent for the plan. If we all stay relatively healthy, getting regular physicals, staying active, eating a healthy diet, we can save the plan larger costs down the road. Think of it as doing regular maintenance on your car. If you never get your oil changed, the car breaks, and that's expensive. Remember to check with your state's specific health and welfare trust fund for questions and to ensure your doctor or service is covered under your particular plan network. Also, be thankful for your health and welfare coverage. Trying to get the benefits operating engineers provide you on your own would be very complicated and expensive. Our plan is negotiated into your agreement and provides high-class coverage. Need more information? Contact the Operating Engineers Local 3 Trust Funds office at 800-251-5014.